Hi, my name is Sophie Detling, and this is a presentation on my CHEAR summer internship. And my faculty mentor this summer was Sarah Clark. So a little bit about me. I am a senior in the undergraduate public health BA program. I'm also doing a minor in English. I am from Lambertville, Michigan, just about 40 minutes south. And also around campus, I am the president of the pre-law sorority, DG5, and a print editor for the undergraduate journal of public health. I'm planning to apply to law school in the fall, and fun fact, I enjoy running and trying new coffee shops. So my initial expectations for the program, I thought work would be really centered around kids and children's health. And I was thrown a little bit of a curveball with working with a little bit more substance use disorder treatment, but I learned a ton and it was actually a great experience. So I kind of read about Sarah's work with Healthy Michigan Plan, but I didn't have any real knowledge of how Medicaid works in Michigan. I kind of thought Medicaid was Medicaid. It was just a blanket plan. And in high school, I had been told like not many people even qualify for it. And then I really had a surface level understanding of the opioid crisis. So the first thing that I began to do some background research and learn more about was Healthy Michigan Plan, which is the Medicaid expansion plan under the Affordable Care Act for Michigan. And again, I realized that Medicaid is not all the same. Since its implementation in 2014, it's been updated with things like the Healthy Behavior Incentive Program, where people can get up to a 50% reduction in their annual copays for choosing a healthy behavior with their provider, like deciding to lose weight or eat healthier or start an exercise program or even stop smoking. And I also learned that this Healthy Behavior Incentive Program is right now in transition from being an incentive to being more of like a penalty with a 5% premium if people don't work on a health behavior goal. But that policy right now is wrapped up in some legal implementations. And as you can see from this map, Michigan is divided into regions, and depending on your region, you have all these different options for healthcare plans, other than the UP only has one option. So it does give people a little bit more freedom to choose what plan fits best for them. All right, so I was able to transcribe some Healthy Michigan interviews. So here at the CHEAR call center, they are interviewing beneficiaries, providers, administrators, all different kinds of sides of the healthcare system every day, especially with a focus on beneficiaries. So transcripts of interviews with Healthy Michigan enrollees who were pretty focused on that health behavior incentive program. We were trying to see what understanding people have of the program. Are people using it, and are they seeing that reduction on their monthly statements? So there was definitely different experiences of access and understanding. And so that really showed me that how you communicate a policy is extremely important, because just implementing doesn't mean that you're necessarily communicating it to the beneficiaries. So then I worked on transcribing some substance use disorder interviews, and these were tribal health, behavioral health services. So these directors worked in these behavioral health service centers that did specialize in mental and behavioral health on tribal lands. And I became very familiar with substance use disorder terms. I hadn't heard of things like methadone or Suboxone before beginning this research. Also the different treatment options and services available. I was also able to join Sarah for an in-person interview with a psych ED social worker, and I got to see that there was a huge difference in treatment access across the different counties, even within the state. Insurance coverage, I was kind of surprised to hear that people with Medicaid had kind of more options, or it was easier to get them into treatment. And also criminal status played a big role on what kind of care was given. And then that plays into also the roles of other agencies like CPS and the police department in the ED. So then I did some more background research on the medication assisted treatment or MAT services. So these are methadone, buprenorphine, and naltrexone. They come in different forms like Suboxone, Subucade. Some are like shots, some are daily dosage. Methadone is a daily dose every day or every day at a clinic. So that's why there's often a lot of stigmatization of that medication in particular. And that's what I learned. Not only did I learn how these affect the body and how they block the cravings, but I also did learn a lot about the stigmatization of a lot of these medications, and methadone especially, since it's mostly seen in areas of higher poverty rates and where often the community is made up more of people of color. Um, so again, we just saw the discrepancies in treatment options, which leads us to the MAT review I performed. So I helped Sarah with this background work for a paper that she is working on to report back to the state on how substance use disorder treatment access and experience are across the state. So I reviewed 50 interviews of individuals currently or previously on MAT treatment. And reading through these, I identified what MAT type they were using or had used, if they had tried a different MAT type in the past, and then especially looking for what did people report as the choices and explanations they were given by their provider when they were deciding on what treatment plan to go with. And then Sarah helped me quantify the responses by MAT type and common experiences. I hadn't really done something like that before, so that was a great experience. And then I compared the respondents' experiences by county, gender, and race. So this is the type of chart I created. So we have Wayne County, which was our highest sample size, with 21 of the 50 participants being from Wayne County. And as you can see, only 6 of those 21 were or clearly reported that they were given a MAT choice. The others, it was either unclear or they said that they were given no choice. It was just like, you will have methadone or you will have Suboxone. So that was very interesting. And again, this is just background work for Sarah's report back to the state. And then I started to learn more about drug courts. And this is all related again to substance use disorder treatment. And so I got to sit in on a phone interview with a Kent County DWI court judge. And this judge actually started the second drug court in the state and really explained to us that there's a huge focus on high risk, high need individuals in this program. When a participant enters a program, they often get to lower their charge down to a misdemeanor as long as they successfully complete this program. And it's a real focus on a team approach rather than more of the hierarchical structure of the normal justice system. So in this team approach, the judge, the court coordinator, the attorneys, the counselors, and probation all really work together. And their kind of motto that this judge explained was trying to be an advocate, not an adversary. And then I got to sit in on a phone interview with the Taylor, Michigan drug court judge and court director. And they really focused on how MAT services are used in the drug court. And it's evolved a lot over the last few years. So they explain that there's no blanket bans on medications. That's just best practices. And they're really shifting to accept addiction as a disease. So if doctors use medication to treat diseases, then MAT services should be offered to treat substance use disorder. And also they focused on returning individuals to normal life, things like interlock car systems, which people need if they want to get their license back after a DUI charge or something along those lines, are quite expensive. And so they're kind of breaking down that barrier by providing those for their participants. And then I also got to transcribe an interview with the Healing to Wellness Court administrator. So Healing to Wellness Court is the tribal version of the drug court. And they follow similar principles, but they have a unique cultural and community aspect to their healing methods. things like sweat lodges and community artisans. For example, participants in one program would go out and work with community artisans on basket weaving as like an outlet, and also to meet different people in their community so that when they do eventually return back, they have others to reach out to besides maybe going straight back to the friends and family who could also still be using, or just again providing a wider environment for them. And these were pretty intensive programs, these healing to wellness courts, because they are felony cases. So the alternative is often prison. And they're quite long, 52 weeks, and then a 6-week aftercare portion. So my key takeaways from this summer internship were that MAT services really are not talked about enough. I had never heard of MAT before this summer. Suboxone, methadone, all these things I didn't know were happening, and it's affecting so many people. And the treatment changes. There's areas of improvement on the policy level, the provider level, and also just the social level of reducing stigma. And I'm really looking forward to exploring this more in this class I'm taking in the fall, Public Health 414, which is a mental health focused class. And we have an entire section dedicated to substance use disorder. And I really want to kind of look into what that connection is with providers, on how they can help shape substance use disorder treatment. And then I also just learned a lot again about how the Michigan plan and the communication aspect of policy, and then problem solving courts as an alternative to the traditional justice system really interests me, because as I mentioned in the beginning, I'm applying to law school in the fall, and I've always expressed an interest in health law or public health law, but I was kind of narrow-minded in the idea that it was more of a focus on medical malpractice suits. And I did not even realize that there were other facets of the legal system, like this problem-solving court with substance use disorder. So again, just things to look into, and I've expanded my horizons this summer, that's for sure. And then I just want to give a huge thank you to Sarah and the CHEAR call center team. I learned a ton about communicating information, and also just the importance of respondents' perspectives, really listening to what people are saying, their concerns, and again, communicating that back to the policymakers. I really learned a lot from them, and also just thank you to the whole team on the CHEAR summer internship program. So I really enjoyed it. Thank you.